Question number 1. Which of the following is an example of an autoimmune disease? The right option is option B, rheumatoid arthritis. Question number 2. The excessive immune response to an antigen is called. The right option is option D, hypersensitivity. Question number 3. Anaphylaxis is an example of which type of hypersensitivity reaction? The right option is option A, type 1. Question number 4. The major antibody involved in allergic reaction is. The right option is option D, IgE. Question number 5. The human immune deficiency virus primarily attacks. The right option is option B, T helper cells. Question number 6. Which of the following conditions results from immune system failure to recognize self antigens? The right option is option B, autoimmune disease. Question number 7. The immune response that causes tissue damage in rheumatoid arthritis is mainly due to. The right option is option C, type 3 hypersensitivity. Question number 8. Which of the following immunoglobulins is the first to appear in response to infection? The right option is option B, IgM. Question number 9. Which test is commonly used to diagnose HIV infection? The right option is option D, ELISA test. Question number 10. The transfer of antibodies from mother to fetus provides. The right option is option B, passive natural immunity. Question number 11. Which organ is primarily involved in immune cell maturation? The right option is option C, thymus. Question number 12. A deficiency of which cells leads to increased susceptibility to infection in AIDS? The right option is option B, CD4 plus T cells. Question number 13. Which of the following is a characteristic of type 4 hypersensitivity? The right option is option C, cell mediated. Question number 14. The autoimmune destruction of pancreatic beta cells causes. The right option is option A, diabetes mellitus type 1. Question number 15. The primary cause of secondary immunodeficiency is. The right option is option B, infection or malnutrition. Question number 16. Which hypersensitivity reaction involves immune complex deposition in tissues? The right option is option C, type 3. Question number 17. Which cytokine is most important in activating macrophages in cell-mediated immunity? The right option is option B, interferon gamma. Question number 18. Graft versus host diseases is primarily associated with. The right option is option D, bone marrow transplant. Question number 19. The deficiency of which immunoglobulin leads to recurrent respiratory and gastrointestinal infections? The right option is option A, IgA. Question number 20. Which of the following is an example of type 2 hypersensitivity? The right option is option A, hemolytic anemia. Question number 21. Which of the following is a common autoimmune skin disorder? The right option is option A, psoriasis. Question number 22. Which immune cells are primarily responsible for allergic reactions? The right option is option D, mast cells. Question number 23. Immune tolerance is important to prevent. The right option is option B, autoimmunity. Question number 24. The cytokine storm is an example of. The right option is option B, hyperactive immune response. Question number 25. Type 4 hypersensitivity reactions are also called. The right option is option D, delayed type hypersensitivity. Question number 26. The main antibody involved in type 2 hypersensitivity is. The right option is option B, IgG. Question number 27. Which of the following is an example of type 1 hypersensitivity? The right option is option A, anaphylaxis. Question number 28. Which organ is primarily responsible for filtering antigens from the blood? The right option is option D, spleen. Question number 29. Autoimmune thyroiditis is an example of. The right option is option B, autoimmune disease. Question number 30. A common symptom of allergic reaction is caused by the release of. The right option is option A, histamine.